What's the importance of ensuring access to safe blood for Africa's mothers in order to better manage and prevent postpartum hemorrhage and reduce maternal death?
Postpartum hemorrhage is vaginal blood loss post-delivery, blood loss of above 1,000 mils.
Kaenda saa 4 theater, wakaanza kunifanyia operation, wakanionyesha mtoto na wakaendelea tu.
After the operation, the stoppage of bleeding was not successful.
Kama hiyo damu haingekuwa hospitali yenye imedonetiwa na watu, mtoto wangu angehangaika.
We were able to save her life because we had the right amount of blood and the right type at the right time.
Damu yangu ikirudi mzuri, naweza donate hata kwa watu wengine.
Thank you for joining us today. My name is Filana Majani, and I work with Terumo Blood and Cell Technologies, and we're a global leader in blood components and therapeutic apheresis. Now, we believe in unlocking the potential of blood, particularly for unmet patient needs. And a big patient group who need blood, as you saw from that video, are mothers. Postpartum hemorrhage is the leading cause of maternal deaths in Africa. And the worst part about this is, in most cases, it's preventable. One of the biggest challenges with postpartum bleeding is that once a mother starts bleeding, you usually have only about 2 to 3 hours before she's going to die, unless she gets a life-saving transfusion or some kind of treatment that will stop the bleeding. This can be compared to other birth complications like eclampsia, where you have maybe 10 hours, obstructed labor, where maybe you have up to 72 hours. But when postpartum bleeding starts, death results very, very quickly unless you have a blood transfusion. Now, you've seen the statistics, you've seen the video, but what we wanted to do at Terumo BCT is try and look at the socio-economic impact of ensuring that African mothers have access to blood, because we believe that there should be a huge investment in blood specifically for mothers. And we worked with hematologists from Ghana, Ivory Coast, and Kenya. And we did an assessment where we found that in those 3 countries, about 17,500 women die every year because of postpartum bleeding. Of these 17,500, almost 15,500 could have been saved if they had had access to blood. Now, the cost of providing that blood or ensuring they have access to that blood was approximately, I think, $34 million. But when we looked at the impact that these women, or the contribution that these women would make socioeconomically to their communities, to their countries, it was about $57 million. That means that if we invest in blood for mothers in Africa, in just these 3 countries, beyond saving that mother's life, beyond ensuring that that family is not deprived of their mother, their sister, their wife, countries would actually see cost savings. It makes economic sense to invest in blood for mothers. And our call to action for policymakers, decision makers, community leaders is to put blood at the center of maternal health, particularly for mothers who are giving birth. Now, the next question might be, well, what can we do? What should we do? There's lots that can be done, but one step that Terumo BCT took was working with other partners. We founded the Coalition of Blood for Africa. This is the first platform of its kind that focuses on ensuring access to safe, sustainable blood for Africans. And one of our key focus areas is mothers. It's a multi-stakeholder platform We have partners from academia, public sector, private sector, research, and development partners, not-for-profits, and several COBA partners are actually at this conference today, so I would encourage you to go talk to them. But what COBA is trying to do is to ensure that because the World Health Organization has recognized that blood is an essential medicine, it needs to be prioritized at our national level, at our county level, our subnational levels, to really ensure that no mothers are dying when they're giving life. And we're crowding in resources, ideas, experience, expertise to come up with the solutions, the ideas, the innovations that will help us achieve just that. So I will stop there because I think I've finished my time, but look forward to any questions or comments.
Thank you, Philana. Blood is definitely a very key discussion all the time in this part of the world, certainly in Kenya, and a life-saving intervention for mothers. Let me move to Nicole. Sub-Saharan Africa has been said to be an emerging arena for digital health innovations that facilitate patient care and education. They also facilitate electronic medical records and healthcare financing. We are truly a hotspot of innovations, digital health innovations. How can we leverage this digital revolution to improve maternal and child care?
Thank you for the organizing, for putting this event together. It's truly exciting to be in the same room again and meet in person. And I'm also very excited to be part of an all-women panel talking about women's health. Not sure if we scared the men away, or this is a positive development. What is actually scary is that when it comes to healthcare, a lot of the decision-making, the policy setting, and as well as the medication and the services being delivered are designed very often by men and not enough by women themselves. And especially when it comes to maternal child health, for women to be able to access services in the public and the private sector, there are actually three aspects that are important in meeting the needs of women in healthcare. And they are, of course, quality of care. Getting women to trust to go to a healthcare facility, making sure that there is medication available there, making sure that the doctor and the midwife and the nurse are qualified, are critical aspects to quality of care. But women also need the financial means to access those services. How do we make sure that they pay for it? And especially when it comes to pregnancy, we know that the costs are significant and we know for certain that those costs will take place. So how do we protect especially lower income women and indigents to make sure that they get a safe delivery? And third, but definitely not least, there is the social aspects of health-seeking behavior of pregnancies. Women often have, if they do work, they have informal sector jobs, selling tomatoes on the streets, doing informal work somewhere else. And it means that if they have to go to the hospital to seek antenatal care, that they might forego that. They might go for their first visit, but they will skip their second and the third visit, thinking they are okay. And it's those visits that are so extremely important because that is where we detect potential adverse events that might negatively impact a safe delivery. So these are the aspects that RMNCH, the organization that I work for, is trying to change. And we use digital technology because if there's one thing that is changing the African continent at a speed that is beyond belief, it's the adaptation of digital technology and the empowerment that it brings to individuals to take care of their own needs. And that can be from the power of M-Pesa that we're all using here in Kenya, and allows us to pay for services without a bank account. And as RMNCH, we've been thinking about, can we use that very same principle to pay for healthcare services and target those people that need maybe subsidies to make sure that the quality of care is available. And mobile technology is doing exactly that. So we started actually a Kenyan company, a company called CarePay. It's based right here in Nairobi. And together with them, we developed a platform that connects patients, payers, and healthcare providers. Now, if you think about the power of digital technology, it allows you with your mobile phone to go to a healthcare facility, place in your mobile phone the PIN number of the M-Pesa number of the healthcare facility, and the system checks that you are really at a real healthcare facility. Now, the system also connects you to payers that want to pay for those healthcare services. Now, that could be yourself as a woman. You might have saved the money that you need to access healthcare services. It could be the government of Kenya servicing Linda Mama or NHIF cover, or it could be a donor that is interested in subsidizing very low income groups and making sure that they have access to services. Through this technology, we have developed a care path, and the bundle itself we actually call Mom Care. Now, the care path designs, together with leading obs and gyne specialists in Kenya, but also following WHO guidelines, it's designing a care journey that specifies when women should be accessing healthcare services, for ANCs, for specific tests that they should be seeking, for going to a healthcare facility and seeking assisted birth delivery. So every time the woman goes to the healthcare facility, she can open her health wallet. She can see her entitlements through Mom Care on what she should be accessing in terms of maternal healthcare packages. And when she opens the wallet, the data is collected and submitted to the payer, who is then, based on the quality of care that is being delivered, is giving the payouts. Now, if, for example, an appointment has been missed, this could be because maybe your child was sick or maybe you had to visit a family member. The system sends an automatic reminder to the women to really increase their adherence, and also describing the importance of seeking ANC visits. But the same system also sends a message to the healthcare provider. This particular woman did not show up, or maybe last time when she was there, you forgot to take a specific test. And it could be that the equipment was broken, but it reminds you that you should be taking the test the next time. Now, as this information is monitored and recorded in real time through dashboards, we can actually look at the quality of the journey. And this is providing an opportunity that is unprecedented to do pay for performance mechanisms and basically healthcare payments that are outcome-based rather than output-based. And we've seen a lot of great initiatives of performance-based financing for maternal child care, but the problem has always been that you could gamify the system. You could do your 4 ANC visits in the week before delivery, which do not make any sense. With this system, you cannot gamify that because it collects the data along the care journey in real time. So you can really monitor but correct as the journey is ongoing, not 3 months later when the problem is already started, but as the journey is ongoing, you can correct it and make sure that the healthcare seeking behavior is there. The system also stimulates proper referral system. Because another reason why we have such dismal maternal child health services is because of lack of proper referral system up and down into the healthcare system, so that women do need cesarean sections because they are high risk, are referred to a proper hospital in time to get that treatment, but then are also referred with that same information back to the primary healthcare clinic for post-healthcare. And the last point that I want to make is that the importance and the transformative nature of digital technology is that you can collect all this information and push that throughout the different stakeholders in the healthcare system. Now, obviously, we're not going to push you the information that says Nicole went to the clinic and she had maybe a poor health outcome, but you can start pushing that information that tells you what is the healthcare seeking behavior of women. What are the big challenges? Are we seeing that women are getting their vaccination? Are we seeing that certain tests are being done? And are we seeing that certain clinics are performing better than other clinics? And it's this real-time information that will also allow for decision makers to target their capacity, their resources, and the financial means to those healthcare facilities that are performing well. And it also allows you to invest in those healthcare facilities that may need a little bit more support to get better. But I think the main point that I want to say is that the empowerment is that all of this is in the hand of the individual woman. She does not have to rely on somebody else to take care of their health. She is in charge financially in terms of the quality of care, but also socially. And let me hand it back to you and continue the discussions. Thank you.
It's amazing, this innovation that is tracing the women through their journey. It is measuring the outcome and the performance of the healthcare provider. It is also bringing ways to pay closer to the client, the woman. And it's taking care of the whole journey in a holistic manner. So Enya, what are the practical examples of digital health applications can we say are addressing women's RMNCH needs?
Well, I think it's definitely a first for an all-female panel to mention things like gamification, digital health, and data-driven technologies, and now artificial intelligence. So that's definitely a first for me. So I guess what I want to shed more light on is really the fact that digital health is really bringing more possibilities and opportunities for women empowerment across the whole scope. And as we all know, educated women and healthy women contribute to more productive societies. A lot of these women will even go on to give birth to the workforce of our next generations, right? So our role with our company, and especially with Baby Checker, which we just launched recently, is to really empower all the stakeholders involved, from the pregnant woman to the health provider, to the project implementers, right? Having females in charge, women as CEOs, female product managers, head of departments. That's also part of a stakeholder, key stakeholder for digital health solutions, to also the whole health system strengthening. So starting with the pregnant woman as the key stakeholder here. As we all know, especially from today, so I'll just say it one more time, 830 women die every day during pregnancy and childbirth. And 70% of those deaths happen right here in sub-Saharan Africa. A lot of these deaths can be prevented if we detect and identify the complications early enough. A great tool to do that is the ultrasound, the obstetric ultrasound. The problem is that exactly in those settings where maternal mortality is the highest, there's no ultrasound, and also there's no or scarcity of medical professionals who can actually use the ultrasound. And that's where Baby Checker comes in. So if you've had the chance so far, we have one right by the food area, if you want to come check it out. So that's exactly what we are tackling here. So Baby Checker is a smartphone-based ultrasound that uses artificial intelligence to identify potential risk factors. And we designed it specifically for those settings where there is no ultrasound, there is no standard ultrasound, and there are no medical professionals. So with Baby Checker, being smartphone-based, portable, and using artificial intelligence, we're enabling this task shifting, right? We've all heard about this, I'm sure, from medical professionals onto community health workers. And there's been a whole bunch of research done, especially in the past few years, about how AI can really enable and empower this task shifting. So that takes me another key stakeholder, the community health worker. I'm sure we're also all familiar with how much of an important workforce the community health workers are. They're essential in bringing the most marginalized, hard-to-reach groups in society into the formal healthcare system. The problem is we rely on them so much, they're so important, but we sometimes fail to provide them with the adequate training, the resources, or even pay their wages. And this is a huge problem because if we rely on them so much, especially throughout this pandemic, and we want more people to encourage them to become health workers, we really do need to create empowerment models around community health workers. So Baby Checker is really trying to motivate community health workers by equipping them with the Baby Checker. It's designed for them. And through a simple 6-week procedure, like you see here on the image, They're able to be trained within around 1 hour to acquire these 6 sweeps. And then our artificial intelligence will give them some results to basically triage a risky pregnancy from a non-risky pregnancy. Another form of empowerment, and this is really reflective of our role as a private sector organization, especially a social enterprise, is that we want to create micro-entrepreneurship possibilities for these community health workers. Imagine now a midwife, like Fatmata in Sierra Leone here in the picture, who can take Baby Checker with her and go out into the community, do her outreaches as she normally does, and now she can charge for a scan. She can charge her clients for a scan. She's becoming an entrepreneur. She's managing her own business. Baby Checker is her business. And that's really what we're trying to explore here. It's early days for Baby Checker, and it's really exciting to present it here for the first time, and to hear a lot of feedback and a lot of enthusiasm, so thank you for that. And that's really, illustrates perfectly how a private sector company with impact in mind can really have a role in healthcare intervention, especially with digital health. So we hope that through this 1 hour of training, 6 sweeps across the belly, and artificial intelligence, we can empower the pregnant woman to have easier access to innovative technologies, necessary health interventions like the ultrasound, closer to her home, to empower the midwife, all the community health workers involved, and the community overall, because everybody benefits from empowered women, right? So, thank you.
Again, I would just like to emphasize the game-changing that's happening on stage today, as said by my previous, my fellow panelists. So when we launched Organon 8 months ago, we decided we were going to launch more than just a company. We were going to launch a commitment to women's health. And we understood as well that, when women rise, so do communities in which they operate. And I think that has been a common thread throughout the conversations that we've had this morning. I do want to bring back some sobering facts around the impact of COVID-19 on healthcare. And in particular, if we look at unintended pregnancies, a lot of women were not able to access sexual and reproductive health care during COVID-19. And as a result of that, it is said that about 12 million women were not able to access the services. And that resulted in over 1.4 million unintended pregnancies. And we know that if you have unintended pregnancies, then it creates this vicious circle of poverty. However, we need to rethink, how do we break that channel? How do we bring back the empowerment to women for them to use things like self-care to ensure that they can remain protected even when there is massive challenges like COVID-19. And we also know that if we invest in women's health, we see a multiplier effect. So one of the issues that we actually need to be looking at is the strategies that we can implement. For example, how do we ensure that we can bring insights of women through, as part of the reforms, to ensure that the voice of the woman is already heard? So when we launched as well, we started a movement called Wall of Voices, and we invited women to actually join the conversation. And it was actually quite interesting because we received thousands of responses. And I think this is just symbolic of how much women want to be heard. And not only be heard, but the fact that they're also willing to be part of the solution. Because as we make solutions, we need to bring her into the conversation. And as one of my panelists mentioned, it's important that we will ensure that we can leave a legacy for the next generation of women and girls. And it's also important to ensure that we highlight some of the key policies that need to be shifted from an economic perspective, but also from a financial perspective, to ensure that women can have the equal opportunities as well to be fully active, not only in the informal sector, but also in the formal sector as well. So we do invite you to go to hereforherhealth.com to join the conversation, but also to have access to this Wall of Voices report where you can gain more insights on this. And then there has been talk around self-care interventions that are available. My fellow panelists have shared some of those, but this is critical, and I think it's especially important in the sexual and reproductive healthcare space, where women are faced with a lot of stigma. You know, there's a lot of stigma around sexuality, reproduction, there's myths, there's lots of barriers to access. How do we bring the solution in her hands, where she actually has that total control of her health care? And then there's also a need for diagnostics as well, which is critical also. And I think the other part, again, referring back to COVID-19, how do we ensure that some of these programs that most of us have shared, that we're working on in partnerships, are resilient even in the face of crisis, like we have seen with COVID-19. So it's absolutely important that we try and minimize these headlines that we come across. How many of us have actually come across headlines about how teenage pregnancy has surged due to lockdown, due to inaccess to healthcare? But more importantly, how do we ensure that we get services to women where they are based? And this makes me love solutions that actually put, and gives us an opportunity to empower more healthcare professionals where they are, to ensure that we reach women in the most remote areas as well.
Thank you, Mogadi. Women need to be where the plans are being made. We need to be part and parcel of those plans so that they are fitting for us. We are the ones that understand our needs best. Let's move to contraception, which is a big part of our health. Over 20% of women of reproductive age in sub-Saharan Africa have an unmet need for contraception. Private sector already plays a significant role in provision of contraceptives, as we know. But Lauren, what more can be done to further leverage the private sector in addressing this unmet need? Because we need to accelerate and bridge that gap of unmet need.
I just want to echo my counterparts in saying thank you to AHB, to Daniela, and to the whole team. I know the effort that has gone into organizing this event, and it's nice, as Nicole said, to be able to gather in person again a little bit. I'm going to speak briefly a little bit on what DKT does specifically with our social marketing activities, as well as the role of the private sector in general for meeting the need on contraception, and where we think it will play a role in the future as well. And I think I have some slides, if they can be put up. But DKT International is the largest contraceptive social marketing social enterprise in the world. We are one of the largest, if not the largest, provider of contraceptive products globally as of last year. We are an organization that operates with a very business-oriented mindset, but at the end of the day, we're very much driven by the core belief that a woman's freedom to determine her reproductive destiny really is one of the most impactful decisions she will make during her lifetime, for herself, for her family, and for the wider society. We operate globally. We have 24 offices in a number of countries, and our products reach over 90 countries globally. We recover about 70% of our operating costs through our sales revenue of our products, which is reinvested into our social marketing activities. And that contributes to a significant health impact that's achieved each year. Last year, we had a record-breaking 52 million CYPs. So a CYP, for the non-family planning people in the room, stands for couple-year protection, and is essentially a metric that converts the volume of products sold into years of protection for couples that are using those products. Those product sales also contributed to averting 11 million unintended pregnancies and 49,000 maternal deaths globally in 2020. And we have lofty ambitions. In the next 10 years, we want to be providing 100 million CYPs globally, and we're covering 90% of our operational costs in sales revenue to work towards more sustainability. Social marketing essentially is leveraging the power of the private sector to make products and services more accessible. We use commercial sales and marketing techniques to bring these products closer to consumers. We register products in the countries where we work. We work with manufacturers globally to develop products. We import, we handle the logistics, we handle the warehousing, or we partner with private sector warehousing partners in the countries where we work. We do distribution of those contraceptive products to a wide range of outlets, either sometimes in the case of DKT directly, but more often we plug into the existing private sector distribution channels in the countries and leverage the reach that those pharmaceutical distributors or those consumer goods distributors have already developed. We do a lot of capacity building. We train healthcare providers, which is particularly important for long-acting methods, so that they feel confident in providing those methods, that they can provide high-quality services, and therefore they'll offer the methods. It's more accessible to a woman when more providers are providing that method. And lastly, we do a lot of demand generation. We use commercial marketing techniques, which is really the most fun part of our job usually. We treat our products like Coca-Cola would treat its beverages. We talk about them in a very fun way. We create brands, we create nice packaging, we use advertising on television, on radio, social media to make these products really be lifestyle brands. We want people to look at a contraceptive like they look at buying a shampoo or buying a bottle of Coca-Cola, and feel like it's part of their daily lives and daily needs, and to reduce the stigma. The private sector, you mentioned a few points on that. It already plays a significant role in provision of contraception. 33% of women globally seek their contraceptive methods at private sector outlets, but in reality, in many countries in Africa, that number is far higher. In parts of Nigeria, it's 70% of women. In DRC, over 50% of women go to private sector outlets. And for certain methods, that's even higher. Things like condoms or oral contraceptives, often 90+% of the condoms in a country are people go to private sector outlets to find those methods. And the private sector is contributing to sustainable supply chains, sustainable demand, and sustainable markets, and increasing availability. So over the last few decades, social marketing organizations and the private sector have really contributed to increasing access to contraception. No longer are the products only available in public health facilities. They're with street vendors, they're at drug shops, they're at private healthcare facilities, they're at bars, they're at guest houses, they're at chemists. So the private sector has been able to bring contraception out of the health facility and really down the street from where someone lives, which brings more convenience and more ease for use of them. And there are two areas where we see the private sector either having the opportunity to contribute more in the near future. In general, obviously we focus on this and we are proponents of the role of the private sector, but we think there's no doubt that it will continue to increase. As economies grow, as people's willingness and ability to pay for products and services increases, people will source their products more and more from private sources. One area where the private sector could do more, and there's a lot of potential to help the provision of contraception, is on long-acting methods. Historically, things like intrauterine devices or implants have been provided almost solely through the public sector. And again, on my slides, you would see a very nice diagram with an example of Kenya, where the stocking levels of IUDs and implants in private sector is far lower than in public sector facilities. For implants, about 36% compared to 96%, and IUDs, only 15% of private facilities are stocking IUDs when surveyed. So there's a huge opportunity there. DKT has registered a range of IUDs to be able to meet that need for the supply of the products, is marketing an implant on the commercial market, and working on training providers to offer those services so that they're more accessible to women who go to private facilities. And the other key area where private sector can really play a role, and where social marketing has and will play a role, is reducing the burden on public sector resources. In many countries around the world and in Africa, the public sector spends a huge amount of money and its financing on buying contraceptive products for the population, which is very much necessary. Often those products are available either formally or informally to private providers, which does create a market distortion and also is a drain on public sector resources that are very much needed to go to those that really cannot afford to pay for services. And that's where social marketing and the private sector can play a significant role. We offer high quality and affordable products and services that can fill that space. For example, in Kenya, injectables are a very popular method. Huge volumes are required, yet there's been a lack of consistently available, affordable options. We recently launched one, and we hope that it relieves a bit of the burden on public sector resources, wherein private sector providers want to offer that service. It's a very needed service, and yet often public sector supply was the only supply of injectables available in the country. So we're looking at ways to bridge that gap, to build accessibility, to build demand, to make contraception fun and exciting, especially for the young people. And yeah, there's huge potential, obviously, as the private sector, the economies grow in general. And we're happy to be along for the ride in terms of contraceptive provision in that way.
Still on the topic of contraceptives, but now let's bring in empowerment of women to make choices that are safe for their sexual health. Empowerment of women to negotiate protection with male partners has been identified as key in increasing autonomy in their choice to practice healthy sexual behavior. As a continent, we have made some gains in community education programs on safe sex. I definitely have seen some changes even in the curriculum of school-going kids, but we still have a long way to go. Frederick, please tell us, what more can we do to empower women to make better choices for themselves?
I also want to say I'm humbled to be here with such a dynamic, diverse and strong panel, only consisting of women. And also want to really thank the Africa Health Business for this conference, and really also want to have a big shout out to saying one day is not enough to talk about women's health. Really, we need a lot more time, but we'll have a go at it. So, and thank you, and really want to talk about female empowerment, women's empowerment, but also really build on the last point from Lauren. Let's talk about fun as well, because we're going to talk about a fun product here. So my name is Frederik Chatfield. I'm the Executive Director at the Female Health Company. And the Female Health Company is the inventor of the female condom. We currently have the product, the FC2. And this product was designed in the 80s, especially for Africa and especially to help empower women. Because at that moment, and still is, women were carrying the brunt of the HIV pandemic, and they didn't have a tool or a device to protect themselves. So you can have the next slide, please. So really, the female condom is a condom, which is of course a barrier method which protects against unwanted pregnancy, contraception, but also against sexual transmissible diseases, including HIV. And I think we all know that. And then our product is also a condom, but a condom that can empower women. So just a few facts about the female condom. They are designed to be worn inside the vagina, and they can be initiated by the female partner. They are non-latex, so they're hyperallergenic material, because it's made of nitrile. And the nice thing about nitrile is that it warms up to the body temperature, so it makes the sex act feel more natural. Another really nice thing is that you can insert the device up to 2 hours before the start of the sex act, so you will have uninterrupted activity. And also you can leave it in after ejaculation, again for longer uninterrupted intimacy. As you can see on the slide, the FC2 is now available in 3 different colors as well, and scents. So we have a red condom with a strawberry scent, a purple condom with vanilla scent, and a brown condom, or the nude condom, with a caramel scent. And of course, as we're talking today as well about planning, it's also a very good product for self-care. Next slide, please. So I already told you that the product is really designed to empower women. But still now, 30 years later, that is the consistent feedback we get from users. As I already told you, there are many benefits beyond prevention for using a female condom. But really, the most important feedback we hear from the users is that they feel more empowered. They feel in control of their bodies. Women can really start the negotiation on condom use with their partners. And that is really, really important. Don't believe only me, there's been a lot of research done on this, and as you can read on the slide exactly what the evidence says. I just wanted to highlight one example there, and that's in Mozambique. And in Mozambique in 2017, there were empowerment sessions with different groups of women out of the communities. And they told them about the FC2, about the product, how to use it, but also about their own bodies, and also how to negotiate with their partners about condom use. And the really interesting thing which came out of that research is that all these sessions and all this training and the knowledge about the product and the bodies made the most difference with the people with the lowest amount of bargaining power. So these women who don't normally have a lot of bargaining power, in being introduced to the FC2, they really were more empowered. And for us, that's really the evidence that the product works, and it helps women. So we really want every woman and girl, wherever they are in the world, to have access to the female condom and be able to choose it if it is the right product for her. So now I wanted to talk a bit about public and private partnerships, because of course that's why we're here for. And one of the things we do is we provide a lot of training about our product, because we believe it's such a fantastic product and we want to tell everybody about it, and we really provide these trainings for free to the governments in lots of countries, but especially in Africa. And so yesterday I was really pleased when I spoke to Dr. Celestine Mugambi from the National AIDS Control Council in Kenya. And she told me something. She didn't only really appreciate our trainings, but she says, you know, your trainings are unique because you not only provide sex education, but you really talk about equality. And that is such a nice feedback to have. You know, that's really what we're trying to do. We don't tell them what a condom is, what the benefits of a condom is, and how it really can give you more pleasure, especially the female condom, but we also talk about their own bodies, what the role is in SRHR of a condom, what else is important. And so we really help women feel more empowered during a sex act, but also learn more about equality. And it's so nice that governments are recognizing that. Other activities we do in technical support are demand generation. Again, we are, like DKT is also doing, we're investing in programming activities, and we are giving consultancy how to increase access to the product and optimize distribution. Because of course we want to provide access, so people need to be aware of the product, they need to be aware where they can get the product, but they also need to have the product available in country. And I really wanted to zoom in for the next slide on an activity we did in Tanzania. And here we had a real partnership with lots of different organizations, really, again, helping the public sector with condom programming. So we worked together with GIZ, the German International Development Agency, Pathfinder, and INGO, and we really, and the Female Health Company, of course, a private organization, but with a social mission, to provide really national engagement with the government to increase the uptake for female condoms and to also reposition the product for the general population. And in that program, the Female Health Company provided funding, and we provided the training and the technical support, and we also did a lot of support on communication, especially on social media. GIZ provided the funding and provided really the expertise on running health improvement programs. Pathfinder was the local implementer on the ground who did the programs and did a lot of the training and implementation of all the ideas. And they really worked together with the government to include the public sector and meet their needs. As you can see on the slides, the results speak for themselves, but we really, it was a very successful project in convincing the women in Tanzania how wonderful the FC2 is, and how it can really help them, and we saw big increase. And hence we really say, you know, when people know about the product and when they know where to get the product, the majority of women and girls really like the product and will continue using the product. So that's really my last thing today. I want to have a call to action to all the government officials who are here, people from the public sector. We are a private company and we really want to work with you in partnership because we want to help women and girls in your communities to know about the FC2 and to have access to the FC2. So they have an extra tool to protect themselves and it will empower them more. Thank you.
Thank you. We have heard that we need concrete plans to entrench RMNCH into UHC frameworks across the continent. We have been told about a very innovative solution called Baby Checker that works in resource-limited settings. We have heard about an amazing digital application that traces women through their RMNCH journey that even measures outcomes and performance of providers. We have also heard about the absolute necessity for safe blood to reduce maternal mortality. And of course, we've heard about the amazing female condom and how it empowers women to make their own choices. I cannot add to what they've said. I'll just ask for your parting shots, starting with Lauren.
You very nicely summed it up. I don't think I could do a better job. I think my parting shot, again, is to look at the private sector as a partner and look at the successes of what private sector has done, maybe not only in the arenas where we work. And this has been something, just hearing about all of these different initiatives and activities that people are working on in different parts of private sector that people are leveraging or plugging into. And keeping an eye out for what private sector is doing well. How can we take those strategies and learnings and those efficiencies and apply it again to a public good and to things that are empowering women, empowering the society, and supporting the public sector efforts. I think it's just a continual challenge to not get into our own niche and thinking and looking beyond and seeing what are we doing, what role are we filling, what more could we be doing, what more can we be innovating on, what is the private sector doing in other sectors that could be applied to public health issues. And I think, again, echoing the diversity or non-diversity in gender, which is good on the panel, it's already sparked ideas of people having used different parts of the private sector globally and here in Kenya, and seeing where we can better leverage some of those strategies and efficiencies for all of our work and for public health work in general.
Thank you, Lauren. Mokadi, your parting shot.
The space of healthcare, improving healthcare, there's still a lot that needs to be done to ensure that we can support governments in order for them to meet the SDG goal, the target 3.8. And it's important to also remember that men are also part of the solution. And I think part of that also requires a mind shift from communities in terms of the men's role in family planning, in maternal health care, as well as child care. I cannot emphasize enough the importance of cross collaboration. So for us to really ensure that we are responding to women effectively, we have to ensure that there's multi-sectoral, multi-stakeholder, multi-layered, holistic approach, and a lot more action-orientated as well. Yes, it's good to have a plan, but a plan not implemented is better than a bad plan implemented, right? So we are all here for her, but we also need to remember that we have to be here with her. So it is critical to encourage co-creation with women who are the ones who are actually utilizing the services, but also push our thinking around innovative financing models that can allow women to access more novel medicines, but at the same time also remain economically active as well. Thank you very much. And thank you, AHBS, for really a great opportunity for us to spend the whole day discussing women. We need more time, obviously.
Anya, your parting shots.
My closing remark is what she said. And on top of that, we need to continue demystifying the role of the private sector in healthcare, I think. There's still some doubt out there that, making profit, social enterprise is geared towards making profit, is what makes our solutions, our products, our services sustainable, scalable, what makes people, more self-sufficient. So there needs to be more dialogue around that. In the past decades, mostly nonprofits have played a very large role in this sector, and I think that now we're, in this shift and having good measurable impact in doing so. And we need to continue having data-driven, measurable impact to prove that we're doing some good. And in regards to baby checkers specifically, so like I mentioned in my discussion points, we're trying to innovate in business modeling for point-of-care diagnostics. So having a pay-per-scan model, for example, we do need an understanding and we do need the cooperation of policymakers in doing so. Because this pay-per-scan model, point-of-care diagnostics, can work very well in the private sector, but we need to make sure it works well in the public sector too, which is mostly where women who need care the most are located. So we need to gain more attention on that topic. Thank you.
Thank you, Enya. Nicole, your parting shots.
Great, thanks. I actually noticed in the conference booklet that you're organizing a men's health conference as well. So interested to hear about that. I hope you'll be discussing the man flu that my husband tends to get quite a lot. But I think, great stuff, and this has been a part of a great discussion. I love the discussion about women empowerment. We've been talking about the need for empowerment of women during their maternity journey, during their healthcare process, and very importantly in reproductive health and taking care of that. It's 2022. We should not be relying on men to take care of that and bring us condoms. We should be taking care of that ourselves and be proud of taking care of that ourselves. So really excited about that. I guess my parting shot would also be a shout out to the women entrepreneurs that are driving a lot of the private healthcare facilities that we've been talking about. They are running these small and medium enterprises, managing them, and sometimes ownership can be a challenge because traditionally a lot of the collateral and the ownership, the rights on property have been owned by the men, and yet the women are often the ones driving these healthcare services. It also makes it very difficult for them, for example, to access loans to offer these great services that we heard the fellow panelists talk about. So I think when we are talking about women's health, I would like to say, yes, let's talk about the patients, the health, not just being sick, but let's also incorporate in our private sector thinking, how can we strengthen the role of private sector and women-led facilities in running these businesses and offering these services that are also empowering women, but are also taking care of the social needs that will impact healthcare utilization. So I hope we indeed will have 2 days or maybe even 3 days to continue to discuss that further and really unpack also success stories that we can then use to replicate through forums as such. Thank you very much.
Thank you. Thank you. Filana, your parting shots.
It's really hard to add much to what has already been said. And of course, I echo it. And thank you, AHB, for organizing this fantastic event. I think one thing I hope you all take away from this is that the private sector are really good at putting women at the center of the solutions that we come up with. And the private sector are really responsive, or perhaps more responsive in some respects, to some of the challenges that women face. And what I hope we see more is the policymakers, the decision makers, looking at the way that the private sector puts women at the center of what we do. Of course, as private organizations, we are profit-driven. But we also have a mission to contribute to healthcare, to improve the lives, to save lives. And it is possible to do that and still make a profit, but also focus on the unmet patient need. And I think as women do become more empowered, the private sector can become a fantastic engine to really drive women's voices and ensure that we are remaining responsive to the actual challenges that they face. And so it was a pleasure to be on a panel with such a diverse group of women who are doing so many exciting things across the board. I just hope that any policymakers or public sector that are in the room are taking notes and looking to see how to partner with some of these incredible organizations. So thank you.
Thank you, Filana. Frederic, give us your final words.
I actually want to empower all of you here in the audience and online, all the women and the men. So I'm going to hand over to Maya. She is our master trainer, and since the inception of the female condom has been working with the product, and she will actually give you a mini training today.
Now to use, and I'm going to use an O tube, which is a vaginal model made out of plastic. Very easy to use. Those of you who are trainers, service providers, a perfect model to demonstrate the FC2. We unroll the product, and who can insert? It's the user, the lady, or her partner can insert it for her, making sex exciting in the foreplay, in the insertion, and she could do it herself. To insert positions, the lady could squat, she could raise her foot on a chair, the toilet seat. Out, people have sex anywhere in the forest, near the river. You can use a stone, you can use a log, whatever you want to use, right? So those are the positions. Or she could lay back and a partner could help her insert the condom. or she could sit at the edge of something and insert the condom, all right? So here, there's an inner ring which is loose, and that is what guides the condom into place, in position in the vagina. So all we do, we bring the edges of the inner ring together to form a point like a tampon, right, in position. Very easy, very quick to use. Insert gently. The vagina is muscular. It will expand to allow the condom in, and it's lubricated on the outside, inside, to make it easy to insert. And as Frederic said, the material warms up very quickly the body temperature, and the lube inside makes it feel close to the natural. And then, in position, it's down here, right? Ready for sex. It can be inserted immediately before sex, or in advance of a couple of hours if a lady wants to be ready for her partner. She's ready when he comes. There's no interruption with foreplay. There's no interruption with the sex act. There's no interruption with the intimacy post-sex. And that is why I say it's an amazing product. I don't want to compare it with any other condom, but this condom can provide you with safe, enjoyable sex. So try it. We've got enough out there at our table. If you want, you're welcome to come and take some. Removal. How do you remove this condom? Very easy. All you do, bring the edges of the outer ring together, twist to close it so that there's no leakage or semen spillage. Gently pull, get hold of the inner ring, pull it out, closed. Back into the packet, not in the toilet, in the bin. And it's for one use only. How's that? I promise you it's an amazing product. Frederic, there's just one more thing I want to say before I leave you. The material, it's natural, non-allergenic, it's soft, it's smooth, it's silky, it's sensual, it's strong, it's safe, it's reliable. I can tell you lots and lots more.
Let's give her a clap. Thank you. Thank you very much. We have learned something new today. What can I say? Please give a very warm clap to our panel. Thank you very much, ladies. That was really interesting.